Top 5 What Warning Signs of Diabetes. Today we are going to talk about the top 5 signs of diabetes. Hi, this is Kate, welcome to our video. Please remember to like and subscribe to our channel. And click the bell icon to be notified of all forthcoming videos like the you're watching now. It is often difficult to tell if you have diabetes. The signs and symptoms can easily be confused with some other medical condition, and besides you don't think they pose serious threats to your life. So you tend to overlook the signs and symptoms, not knowing that your life is at stake. The two most common types of diabetes are type 1 and type 2, and although the situations that result to either type are different, presenting signs and symptoms of both diabetes types are more or less the same. Type 1 diabetes results from the destruction of cells that produce insulin, and this type of diabetes commonly occurs in children and young adults. In the case of type 2 diabetes, insulin is produced, but then there is an inability of the cells this time to make use of the insulin. This type of diabetes is common among the older generation. Notwithstanding the type of diabetes, it is very important that you know how to spot the warning signs of diabetes for you to be able to immediately take the necessary precautions. Remember that the earlier diabetes is diagnosed, the better are the chances of controlling it, thereby reducing risks of complications. In a nutshell, diabetes happens when a person has very high levels of blood sugar. These high level of glucose in the blood is what triggers problems that are often used to indicate early signs of diabetes. So, here are the list of warning signs of diabetes. Number 1. Frequenting the toilet. If you happen to go to the bathroom more often than before, that should already cause you to wonder if you have diabetes. You see, when you have diabetes, the insulin produced by your body may not be enough for the kidneys to filter the sugar back to the blood. To compensate, the kidneys become overactive and there is a need to extract more water from the blood. The extra water makes the bladder full, the reason why there is an urgency to urinate when you have diabetes. Number 2. Thirst. With frequent urination comes another telltale sign of diabetes, thirst that cannot be quenched. In response to the extra water that is extracted from the blood and out of the system in the form of urine, the diabetic drinks more water than necessary. Number 3. Weight loss. Rapid weight loss can also occur, especially in the case of type 1 diabetes, when not enough insulin is produced by the pancreas. Thus, instead of using insulin to produce energy, the body makes use of fat cells, and because the cells are starved of energy, fatigue can be a common problem. Number 3. Slow healing wounds. Slow healing of wounds, itchy skin usually in the groin area, also occur with diabetes. Number 4. Tingling of hands and feet. Numbness or tingling of the hands and feet. This symptom usually develops over a period of time. The numbness or tingling sensation is called neuropathy. Number 5. Blurred vision. Not heeding the warning signs of diabetes can cause further complications like retinal damage that leads to blindness, gangrene and amputation due to poor healing of wounds and cuts, chronic renal failure, and cardiovascular disease. Please note, the early detection of a disease like diabetes is essential in treating it successfully. Sometimes the signs and symptoms of diabetes are harmless and ordinary, that they are brushed aside. Aside from that, symptoms of diabetes develop very gradually, that about a third of people who have diabetes, especially type 2 diabetes, are not diagnosed until complications happen. It is important to know what these are in order to start treatment right away and prevent complications from developing further. There are several risk factors that would indicate that a person might be predisposed to having diabetes, like having a family member with diabetes, heart disease, gestational diabetes during pregnancy, high blood cholesterol level, obesity, a sedentary lifestyle, polycystic ovary disease in women, and previous impaired glucose tolerance. Some ethnic groups are also more susceptible to the disease, like Hispanic Americans, Native Americans, African Americans, Asians, and Pacific Islanders. Having check marks on 2 or more of these risk factors should be taken as warning signs of diabetes. Going to the doctor is advised for further testing to confirm if one does have the disease. Thank you for watching this video.